If your patient has a PEG tube, you're probably going to do some PEG tube site care at some point. So usually PEG tubes will have a dressing of just a split gauze around the tube and over at the insertion site. So when you go to change that, you're just going to remove the old dressing, clean the site with some saline or some warm water and soap and pat dry, apply a barrier cream to protect the skin, and then go ahead and apply that new dressing and secure it down with some tape. So the other thing about PEG tubes that I want to mention is if you look at that second picture, you see a valve there. It's called a Lopez valve. And when you are feeding your patient, giving medicines, irrigating the tube, doing anything like that, you have this little on-off nozzle, and that controls the flow going in and out. So if you are not using it, you want to make sure that the valve is closed so nothing is spilling out of the patient. If you're instilling something, you want to make sure you have two-way flow so that you have the arrows pointing both ways so you can instill things. But remember, when you're doing this, this means that things can also backtrack from the patient, so just be careful.